EMT Practice Test. Part 1. 1. First responders, such as firefighters, law enforcement officers, and park rangers, are an integral part of the EMS system because the presence of a person trained to initiate BLS care cannot be ensured. They are often trained to assist the advanced level EMT with procedures. The average response time for the EMT crew is approximately 15 minutes. They can initiate certain advanced life support procedures before EMS arrival. The answer is A. The presence of a person trained to initiate BLS care cannot be ensured. 2. Which of the following scenarios does not involve the administration of advanced life support, ALS? A 48-year-old apneic patient who is intubated by the nasal route. A 53-year-old cardiac arrest patient who is manually defibrillated. A 61-year-old trauma patient whose chest is decompressed with a needle. A 64-year-old cardiac arrest patient who is defibrillated with an AED. The answer is D. A 64-year-old cardiac arrest patient who is defibrillated with an AED. 3. Which of the following is a unique function of the emergency medical dispatcher, EMD? Relaying relevant information to the EMTs. Directing the ambulance to the correct address. Obtaining patient information from the caller. Providing callers with life-saving instructions. The answer is D. Providing callers with life-saving instructions. 4. What type of medical direction do standing orders and protocols describe? Radio. Online. Offline. Direct. The answer is C. Offline. 5. The Continuous Quality Improvement (CQI) process is designed to identify areas of improvement and provide remedial training if needed. Ensure that all EMTBS maintain certification through the NREMT. Provide punitive action to EMTBS who do not follow local protocols. Focus specifically on the quality of emergency care provided to the patient. The answer is A. Identify areas of improvement and provide remedial training if needed. 6. EMTs who follow a coordinated continuum of care do so because it maximizes survival and reduces patient suffering. Tradition demands doing what we have always done. The medical community requires progressive phases of care. Definitive care is most easily provided in a pre-hospital setting. The answer is A. It maximizes survival and reduces patient suffering. 7. Obtaining continuing medical education is the responsibility of the State Bureau of EMS. EMS Training Director. EMS Medical Director. Individual EMTB. The answer is D. Individual EMTB. 8. Which of the following is not a skill that is provided by the EMT Basic? Initiation of an intravenous line. Automated external defibrillation. Administering supplemental oxygen. Assisting patients with certain medications. The answer is A. Initiation of an intravenous line. 9. Which of the following statements most accurately describes emergency medical services, EMS? A vast network of advanced life support (ALS) providers who provide definitive emergency care in the pre-hospital setting. A team of healthcare professionals who are responsible for providing emergency care and transportation to the sick and injured. A system composed exclusively of basic-level EMTs who are responsible for providing care to sick and injured patients. A team of paramedics and emergency physicians who are responsible for providing emergency care to critically injured patients. The answer is B. A team of healthcare professionals who are responsible for providing emergency care and transportation to the sick and injured. 10. Although transport time to a specialty center may be slightly longer than to a local emergency department, specialty center physicians are more highly trained. Patients must always be taken to the closest hospital. The patient will receive definitive care more quickly. All patients should be transported to a specialty center. The answer is C. The patient will receive definitive care more quickly. 11. You have been working at the scene of a major building collapse for 8 hours. Many injured people are still being removed, and everyone is becoming frustrated and losing focus. This situation is most effectively managed by providing large amounts of caffeine to the rescue workers, requesting a CASM team to provide on-scene peer support, conducting a critical incident stress debriefing the next day, allowing each worker to sleep in 15 to 30-minute increments. The answer is B, requesting a CASM team to provide on-scene peer support. 12. Determination of exposure is an important part of an exposure control plan because it determines the time of day that most exposures are likely to occur, determines which type of communicable diseases might be present in the workplace, defines who is most likely to transmit communicable diseases in the workplace, defines who is at risk for contact with blood and body fluids and which tasks pose a risk of exposure. The answer is D, defines who is at risk for contact with blood and body fluids and which tasks pose a risk of exposure. 13. You are caring for a 40-year-old female who was involved in a motor vehicle crash. Her husband, who was driving the vehicle, was killed. When the patient asks you if her husband is all right, you should tell her that he is being resuscitated by other EMTs. Immediately tell her of his death so that she may grieve. Let clergy or hospital staff relay the bad news if possible. Avoid answering her questions and focus on her injuries. The answer is C, let clergy or hospital staff relay the bad news if possible. 14. Carbon monoxide blocks the ability of the blood to oxygenate the body because it binds with the hemoglobin in the red blood cells, causes filling of the lungs with copious secretions, causes the body to expel too much carbon dioxide, destroys the number of circulating red blood cells. The answer is A, binds with the hemoglobin in the red blood cells. 15. The simplest yet most effective method of preventing the spread of an infectious disease is to undergo an annual physical examination. Ensure that your immunizations are up to date. Wash your hands in between patient contacts. Undergo HIV and TB testing at least twice a year. The answer is C, wash your hands in between patient contacts. 16. You are summoned to a convalescent center for an 88-year-old female with an altered mental status. A staff nurse advises you that the patient has terminal cancer and that her physician stated that she would probably die within the next few hours. A valid do not resuscitate (DNR) order is presented to you. When caring for this patient, you should depart the scene and allow her to die with dignity. Start CPR if she experiences cardiopulmonary arrest. Provide no interventions and transport to the hospital. Make her comfortable and provide emotional support. The answer is D, make her comfortable and provide emotional support. 17. If it is not possible to adequately clean your ambulance at the hospital following a call, you should quickly wipe down all high-contact surfaces with an antibacterial solution. Clean the ambulance at your station in a designated area that is well ventilated. Wait until the end of your shift and then disinfect the entire patient compartment. Thoroughly wash the back of the ambulance at a local car wash or similar facility. The answer is B, clean the ambulance at your station in a designated area that is well ventilated. 18. A critical incident stress debriefing, CASD, should be conducted no longer than hours following the incident. 6. 12. 24. 72. The answer is D, 72. 19. You are transporting a 40-year-old male with respiratory distress. The patient tells you that he recently had a positive TB skin test and is currently being evaluated for possible tuberculosis. You should apply a nonrebreathing mask on the patient and a HEPA respirator on yourself. Remain at least 3 feet away from the patient and apply a surgical mask on him. Apply a sterile surgical mask on yourself and a HEPA respirator on the patient. Apply a nasal cannula on the patient and a sterile surgical mask on yourself. The answer is A. Apply a non-rebreathing mask on the patient and a HEPA respirator on yourself. 20. Critical incident stress management, CSM, can occur at an ongoing scene in all of the following circumstances, except when personnel are assessed during periods of rest, before personnel are preparing to re-enter the scene, when patients are actively being assessed or treated, before leaving the scene after the incident is resolved. The answer is C. When patients are actively being assessed or treated.